recording as well as a small shabd that he has sent.
Dr. Bhupinder Singh Anand was the son of Dr. Santokh Singh Anand, who was the founder member and was also the director of PGI Chandigarh. When I look at his life, I feel like there are four types of people are often seen in the world. First type of people, those who live their life like useless, gambling, drinking alcohol, women or prostitutes. They spend their whole life doing these things. Second type of people, they buy properties for themselves, accumulating wealth for themselves. Such people neither think about humanity nor about God. Those are working people. Their life is limited only between office to home and from home to office. The third type of people are the benefactors who do perform prayers and nitnem and make donations. Also, they do good work, but only for themselves, and do not think that others should also live a good life. Fourth type of people are beneficent. They think for the welfare of humanity and do some blessings for the world, which Dr. Santokh Singh Anand and his son Dr. Bhupinder Singh Anand did. Dr. Bhupinder Singh Anand was India's greatest specialist in curing stomach disease of his time. He was a best teacher. He started GB Pant Gastro Department in Delhi Hospital. We pay our tribute to Dr. Bhupinder Singh Ji. May God give him place at his feet and give strength to the family. There's no greater distance than being lost, and no greater closeness than remembering. A person put his glasses on his head many times, and when he needs to read something, he searches for the same glasses in other places. That's because he forgot, and the glasses went away. That's why, if we forgot someone, then that person goes away from us. But a personality like Dr. Bhupinder Singh Ji works in their life to set an example of humanity. Because of his good deeds, he will always be remembered in the world because of his light, and he will always be our source of inspiration. Hence, we pay our tribute to him. Deho sajan asisaniya, jiyo hoye sahib seo meel. Vaheguru ji ka khalsa, Vaheguru ji ki fateh.
Over to you, Ashwini. Please.
Good evening, ladies and gentlemen, to you all, and good morning to all those who are with us today from the US. We have gathered today, though virtually, on this somber occasion to pay our homage to Dr. B.S. Anand, a legend in gastroenterology and one of the finest human beings of our times. My name is Ashwini Setia, one of those whose future and life was shaped by Dr. B.S. Anand in no small measure. In this hour of grief, my heart goes out to Sonuji, Govind, Manveer, and their lovely families, as also to Dr. Indar Anand, who are with us today. I, along with Dr. S.P. Mishra, would be your host today. He has touched so many lives in his lifetime that we have so many of them today to pay their homage and last respects to him. Thank you for appreciating the time constraints we are operating in. With this, may I request Dr. Govind Anand to please say a few words about his immensely respected father. Dr. Govind, please.
Good morning for us, good evening to you all, and thank you for hosting this wonderful celebration of his life. He was an incredibly proud Indian, and he spoke so fondly of his time.
Recording in progress.
And very fondly of his time in PGI and GB Pant, and Manveer and I grew up hearing tremendous stories of his associations with all of you and the wonderful research he did, the clinical care he performed there. And it influenced him greatly, and it influenced both of us greatly in a deep and meaningful way. Many of you know he was diagnosed with pancreatic cancer about 10 months ago. He did chemotherapy, radiation, and was actually doing quite well, getting ready for additional chemotherapy in a few weeks, and was strong. He'd gained back some weight and unfortunately passed away peacefully last Monday. We miss him dearly, but he lived a wonderful life. So thank you again for this wonderful remembrance.
Thank you, Govind, for those words which actually emanate from each one of our hearts. And as I mentioned, it is very hard to find a soul like him. May I now request your Taiji, Dr. Anand, to say a few words, please.
Thank you so much for hosting this meeting, Ashwini ji. We are most grateful to all of you assembled there. It really is a very somber day for all of us. And of course, Bhupi being such a remarkable person, as most of you know, that it needs to be celebrated in the fashion that you have desired to do. All I would like to say now, before we start listening to others, is that the family, including Sonuji and the kids and the grandkids, and from our side, we are extremely grateful to all of you and to everyone who has assembled in Delhi, and some of us from this country, to pay these tributes and to celebrate his life, as I said before. So thank you, and I'll pass it on to Ashwini.
Thank you, Dr. Anand. I know how it would feel, and it will be very difficult to get over these moments of grief. But such is life, and we have to all go through this. Dr. Anand, during his sickness, was associated very closely with Suresh Chari and Raju. And I would like Suresh to please say a few words, because we do not know how his sickness was dealt and so on. Suresh, I think you are the best person to do that, and thereafter Raju.
Thank you, Ashwini. Dr. Anand and Govind have described his course, and also the thoughts expressed by everybody here and everybody who's going to talk after me will resonate very much with each other, because he left an indelible mark on all our lives. To me, he not only taught medicine, but he taught how to live life. And in many ways, how he conducted himself, his amazing positive attitude, and the amazing resilience he showed in transitioning from India to US. He was at a time when he came here, he didn't have a license to practice. And yet he hung in there and worked his way to getting what is needed to do practicing in US, and did very well, successfully so. And all these are inspirations for us in terms of how we lead our lives and how we deal with uncertainty. But 10 months ago, he called me on the phone and said, Suresh, I'm jaundice. I think I have pancreatic cancer. This is just incredible. Those words are still ringing in my ears. Because, he was a gastroenterologist. He knew what he was talking about. And sure enough, Raju then helped set up all the appointments at MD Anderson. And sure enough, in a few days, we knew that was indeed the case. But the dignity and the calmness with which he handled that, again, I pray that I have such fortitude and such grace in the face of such a grave diagnosis. We met him in between, and again, he was tired, but my wife is going through some difficult times, and he had this one to ask about her and make sure that she's okay. And just extraordinary till the very end. The absolute gentleman, the absolute person who cares about the other, and just an inspiration from beginning to end. So God puts people in our path who help guide us and show us the way. And I'm extremely grateful for having known him in my life and for him having made such a deep impression on not just my medicine, but my attitude to life. So thank you so much, and my sincere condolences to the family. Raju did a lot of the work for him at MD Anderson. So Raju will also have very close insights into how he dealt with the disease.
Thank you, Suresh. I think all of us are full of gratitude to the Almighty for brought Dr. Anand in our lives, and the way he taught us about life. Since Raju was also very, very closely associated, may I ask him now to please share with us his feelings today.
Good evening, my friends, and Inder sir, and Gobind. We have high admiration for Dr. Anand, and I would like to be brief, and I want to say a couple of things. When you go through your medical training, you see, and your paths cross with several mentors, and some of them stay with you for a long time in your life because of who they are, very special souls. And I would like to describe Dr. Anand as a gentleman and a scholar. When I say gentleman and scholar, we use those words quite often, but he is very, very special. He knows, there are so many people here who came together to share how their lives were touched. He knows how to give, and he knows how to give generously. And that is something very special about your dad, Gobind. And the reason I actually, my wife came and said, "Hey, how come you got dressed like this?" I wanted to share with her that out of respect for Dr. Anand, that he's always impeccably dressed. And I put this, this is the background of MD Anderson. I put this slide to honor him for what he has done to me personally. He was responsible for my trip out of India to England. His letter of introduction allowed me to go and work with Dr. Baradan. Gobind, you may not know this, but I think in people's lives, people make a difference, and he is very, very special. The other thing that I admire about Dr. Anand is, in life, we all fight our own battles, right? Ups and downs in life, whatever they are. Sometimes, not quite often, we always draw everybody else into that battle. But one thing special about Dr. Anand is he fought his battles, whatever in life, and towards the later part of his life, he fought all the battles alone, without drawing everybody into that battle. That is something very unique and very special about him. And during, Gobind, you know this, throughout his care at Anderson, except for a few occasions when he needed some assistance, he managed everything on his own. And that is something not many people do, unless somebody is very, very special. I also want to share this with you. It is a great loss for you, your brother, and your children. But I want you to know this. There are many who've been touched by Dr. Anand, and we are here to serve and serve as a reflecting board for you if you need us. And I want to say thank you to you and your family, and also to the Anand family. Anand family is a very special family in India for their mark that they put on the medical practice in India. Thank you. Thank you, Ashwini.
Thank you, Raju. I think I'm at loss of words to express myself regarding the things which you have told. There were several times that I spoke to him during his sickness, and every time he would say, "ठीक है यार, चल रहा है यार, हो जाएगा ठीक." And a couple of times I could sense that he was in pain. Even then, he would not say that he was in pain. I could sense that he was in pain. Unfortunately, despite my having gone to the US, I could not see him because probably that time he was very sick and did not connect. But that was what is destiny. Along with him, we have one very special teacher of ours, Dr. S.L. Brood, who has been with us there in GB Pant and prior to that in PGI also. May I request Dr. Brood sir to please say a few words. Thank you.
Friends, it's a very sad moment for all of us. My association with Dr. B.S. Anand, we used to call him Bhupi, goes back to early 70s when I was doing a BM in gastroenterology and we were doing medicine at Chandigarh. Thereafter, we spent a few years at PGI as faculty and then at GB Pant Hospital, New Delhi. The Department of Gastroenterology in GB Pant was started, I think, by Dr. Anand around 79 or 78. And the growth of the department was very rapid, very impressive. And very soon, GB Pant became a center of excellence, very popular for patient care, for DM training, and for research. Now, everybody in the department worked undoubtedly towards these goals, but surely in the formative years, in the initial years, Dr. Anand played a very, very crucial role. Dr. Anand was a very caring physician, an excellent teacher, and a great research worker. He was loved by his patients, by his colleagues, and respected a lot by his students. He was a great thinker, an intelligent person. I remember at GB Pant, he had some complex department issues, academic activities, he would come out with a very simple solution even for the most complex problems. His demise is a great loss, not only to his family, not only to the GB Pant group, but it's a great loss to the entire gastroenterology. I would like to express my sincere condolences to the family. We may not be able to decrease their pain, but certainly like to assure the family of our love and respect, which will stay for many years to come. Pray to God that his soul rests in peace, and pray to God that God grants peace, serenity to his family members, to his wife, to his children, and other family members in the midst of this pain. Om Shanti, Om Shanti, Om Shanti.
Thank you, sir. I would like to hand over the proceedings from now on to a very close friend of mine, Dr. S.P. Mishra, and one who was really loved by Dr. Anand. Dr. S.P. Mishra, please.
Thank you, sir. Well, what to say about Dr. Anand? Everybody has said so much, but everybody over there, especially Dr. Anand, such a fatherly figure despite having a age difference of few years between us. And what Raju said was mentioned by me on my Facebook post when I heard about this. He really shaped our lives. And what I'm living today and what I've lived till date is mainly because of Professor B.S. Anand. 5 o'clock in the evening, he used to shut the door of his office and he said, no more gastroenterology. So that was one lesson for me. Another quote of his is, whatever you do, even for a local journal, put your best foot forward. So these anecdotes of his will always with me, and I've really lived a life which he wanted me to live. Very grateful to him, and big loss for personal loss for me. I wish Sonuji, Gobind, brother, their children, Dr. Anand Saab, God give them courage to bear the loss. And may I request Professor Sareen Saab, who was one of our teachers over there, and that was the golden period of gastroenterology department of GB Pant. I think everybody will agree with me. Sareen sir, few words from you, sir.
A heavy heart that we accept the destiny. I joined in 1983 beginning and was welcomed by Professor Anand, a stylish, articulate, and a wonderful human being. And as SP said, we all grew. I was the youngest, but was given huge responsibilities, especially of liver. I remember him for many things, and especially his clinical acumen and clarity that I will do this and I will not do this. I'll do pancreas or bowel, but I will not do so many other things. So I think that was an excellence to publish, was also to keep the students together, was also, these were his strengths. And he was very lively. We will miss him. The whole department at GB Pant and all his students will pray together, and may him rest his soul in heaven in peace, and to the whole family. I would say that we will always remember him through his work and through his messages. Thank you.
Thank you, sir. May I request Dr. Ajay Kumar?
Well, see, Professor Anand, as a teacher, as a guide, as a mentor, I think enough has been said about him. I'll just add on the few things as a student of his, which touched our lives. Of course, he taught us the clinical medicine, but what is more touched us more as a personal is his friendly mannerism. We never feared him. We always respected him. And the issue was that any issue, whether it's related to the department, it's related to the patient, or it is related to any personal life, you could just walk into his room and he will never ask you to wait, and he will dispose of and find a solution or suggest a solution in few minutes, and you come back with a peace of mind that you are there's somebody to after you. So I will say he was more of a friend for everybody who ever came into contact with him. And the second thing which I would like to highlight, that for us, actually, who had never done a thesis in MD, I mean, how to do the research, I think that is something which he was saying that you just open the book and you start answering, you will find that a lot of statements are there which have no proof. You just open it and find an answer to that, or prove or disprove what is being said. So he has left a legacy, and we like to convey from all the alumni side that we are always here, and he has a huge. He will never be gone for us. He will always be there with our thoughts and memories. and always there to guide us. And we pray to God to grant him peace. Thank you very much.
Thank you, Ajay. All of us who have been taught by him or have been associated with him, he is a legend for us and he'll always be a legend till our last breath. May I request one of his very close associate, Dr. Dilavri sir, to say a few words.
First of all, my heart goes to the family at this hour of grief. I knew Bhupi right from his days in England. He was in Oxford and I was in London, and we both were planning to come to PGI, and he said, why don't you come in my car? Because he was going to take Volkswagen to India. I said, no, Bhupi, I can't go. I'm just got married. I can't go with you at this time. And in PGI, we had a fantastic time together, learning gastroenterology, how to practice gastroenterology in India. And he has always had a practical approach to gastroenterology and to the science of gastroenterology, and was very admirable. I enjoyed his company tremendously. He was a fun guy, and he had a difficult question he could ask people he didn't know in such a way that it didn't annoy them, it didn't feel difficult. He has a very pleasant way of asking difficult questions. And he has a personality which gets into underneath your skin very comfortably, very comfortably. And enjoyed his company very much. I was sad when he left PGI after 2 years, went to GB Pant. And I was even more sad when he left India. First of all, he was lost to PGI. Then he was lost to India in gastroenterology. And now I feel he has lost to the whole field, the community of gastroenterology now. He was such a great gastroenterologist, I can remember. And Bhupi was fun guy. Fun guy in the sense he joked with me, he said, Jang, huntu niyane karla, time aa gaya. So, and he was a past his remarks without offending anybody. And I still remember him, his company, we joined together for a lot of foods in Chandigarh, and I really enjoyed his company. And Inder was also very closely associated with us at that time. And I would like to pay homage to my friend, Yes Anand, and to the whole family. Thank you.
Thank you, sir. Yes, he was a complete human being, and he was really hilarious and funny, and as well as serious at times. And we learned so much from him. He initiated me into research, and which I have been continuing at Allahabad for such a long time. Blessings from Dr. Sareen as well as from Dr. Brewer is there. May I request Dr. N.K. Ganguly, sir, to say a few words? Dr. Ganguly, sir.
And my condolences to Sonu. My condolences to Sonu.
Dr. Ganguly, sir, is at a place where the connection is not very good.
This has been heartbreaking for me. He was not only my research partner, he was a close friend. He did work with Deborah Doniak on celiac disease and gluten allergy. With path-breaking work, he came to absorption. This was a common theme with us. So wherever we went, as I said that we were research partner in experimental medicine, and we took us to present it. He presented part of that I and went to Azad Khan, worked with him with the weird Deborah Doniak there. And whenever I went, I had stayed with him in his NXC outside of Chinese house in Defense Key.
Yes, we have lost his voice. Any technical issue?
But
Dr. Ganguly sir, in case you can switch off your video, then your voice will be clear because your bandwidth is low.
Bandwidth is very bad. Okay, may I request Gagan to say a few words, please? See Gagan there.
Yeah, good morning, everybody. Those who don't know me, I'm also an alumni of GB Pant. We are here to remember Dr. B.S. Anand, our esteemed teacher. And he made transition to US while we were in our, I think, the first year of our fellowship. And I had the privilege to join him back here. And I joined Baylor, and he was a senior professor. Here, always more than being a guide, mentor, he was a very close friend. I still remember my conversation, even in front of people, he will never speak English. We always speak Punjabi, and that just sometime irked some people what you are talking about. We enjoyed it. But he was always a friend. We met in many social gatherings. He was a life of all these social meetings, you know. He was very well respected and very well liked in the department. And I can tell you, our chair of medicine sent a very strong words of appreciation for him. He was a master clinician, very influential researcher, and an outstanding educator. And really, all these words meant what he was. We are definitely going to miss him. He was a great teacher for us. As many of you has echoed, he shaped our life in many ways. And we really miss him. Our deepest condolences to the family.
Thank you, Gagan. Yes, we'll all miss him forever. And anybody else? I saw Dr.
Rakesh is there. Rakesh Nanda was there.
Dr. Rakesh.
I'll say a few words.
Yes, sir.
For those who don't know me, I'm Rakesh Nanda. Well, actually, I knew Bhupi because I was one of the first few people who joined the department before the fellowship. And we always called him Bhupi. So he was a close friend. We kept in touch throughout. He shaped my career like everyone else. And then, throughout the time, 5-6 years in Delhi, he was very informal, very humble guy. And actually, when he passed away, somebody called me from Houston who's not a GI person. And she said, "Oh, Bhupi is gone." And I said, "How did you know that I knew him?" Because she's a physician, but she said, "Oh, I think you always talked about him." And she said he was the only gentleman doctor she knew in Houston. And those were pretty strong words. So I don't want to go on about this, but I've kept in touch. Long association. I attended his wedding, and then a surprise, that I went to Govind's wedding here in LA. So we kept in touch as friends. So we'll all miss him. And Bhupi was always fun. And he's always speaking Punjabi and saying, "Ki haal hai fir? Sab theek hai?" So condolences to the Anand family.
Thank you, sir. Yes, Dr. Anand was a legend, and he'll be a legend for all of us, and maybe for the next generation, another generation to follow. And I'm grateful to all of you for joining today for this condolence meeting. Again, I extend my condolences to the family and to all of you. And कहते हैं ना कि हमारे बाद महफिल में हमारे अफसाने होंगे, वही सही सच बात है. हमारे बाद अब महफिल में बस हमारे ही अफसाने बयां होंगे. And the biggest tribute to him will be to follow his legacy, to continue it, and to pass on to the next generation. We are all teachers. Let's pass on his legacy to the next generation and keep his memory alive. Thank you very much, all of you, for joining. Dr. Ashwini, sir, want to say some word?
No, thank you so much. And as has already been said, we possibly cannot improve on that. And our heart goes out to the family. Everyone, please accept our deepest condolences. Thank you so much.
Thank you.
Om Shanti.
Thank you all. This is an incredibly touching tribute, and it means the world to hear these words.
Thank you, Govind. Prayers
Thank
for
you. Thank you.
Thank you.
Our conference has